And how does this clinical research help in developing an evidence-based mindset among homeopath graduates, sir?
Right, I will tell you a small story. I have joined BHMS in 2002. After 2002, I have completed my BHMS in 2008. In 2007, what happened is there was my senior. His name is Srikanth. Srikanth Madunagla. He has completed MD. He gave me a book. Normal, he practices allopathy. At that time, he was practicing allopathy. He gave me a book. I know you are scientifically oriented. Read this book. That book is Allopathic Pharmacology. Basically, it contains what is pharmacology. Pharmacology means pharmacokinetics and pharmacodynamics. It is a scientific way of describing a drug. After reading that book, what I thought is homeopathy is not a medicine. There is no medicine. It is all dummy. It is all placebo. And 2008, I left homeopathy. From 2002, when I was a first year student, to 2008, final year student and internship, I practiced homeopathy very sincerely. I've seen a lot of results, some hundreds of cases and thousands of cases I have treated within these 6 years. After 2008, I have left homeopathy after reading this book. This gave me scientific approach. I want to pursue homeopathy in a scientific way. That's the reason I have ventured into clinical trials, and I have did my masters in clinical trials from Sikkim Manipal University. Once you develop that, you will apply the same thing in homeopathy as well.
Yes.
Most of our seniors I have seen saying that this is not our science, that is our science. Why do we think about other science? There is no different two types of sciences,
Yes.
right? Anything that goes into the body, it has to absorb somewhere, it has to be distributed in the body, it has to be metabolized, it has to be eliminated. Whether it is homeopathic medicine, allopathic medicine, ayurvedic medicine, siddha medicine, even water you drink has to absorb, has to be distributed, has to be metabolized, has to be eliminated. Even air you breathe has to be absorbed somewhere, has to be distributed, has to be metabolized, has to be eliminated. That is pharmacodynamic kinetics. Any drug you take will have an pharmacological action. For example, you take antacid. Antacid is a base. The stomach contains acid. There will be acid base reaction. It is neutralized. In the same way, every homeopathic drug will also have its action. That has to be described, that has to be studied, that has to be scientifically published. That we have to do, rather than saying this is not our science, we have vital force, I will hit you, you will have pain, can you show me the pain? These type of things are nonsense. This should not be done. If you speak this kind of language, no one is going to respect you. They think that homeopathy is useless. This is not the language you should be speaking. You should be speaking in terms of pharmacokinetics, pharmacodynamics. That is the scientific way of approaching a homeopathic medicine. You will develop these knowledge, these skills, this experience once you know what is happening in clinical trials. When you go into clinical trials, every clinical trial you see from the perspective of homeopathy, and then you will understand homeopathy is highly scientific than compared to any other system of medicine. What these people are doing now, developing nanoparticles, this homeopathy has done 2500 years ago, right? What medicine dilutions we are using, they are all nanoparticles. The nanoparticles are synthesized in two way, right? Either top down approach, bottom up approach. Top down approach is our trituration, bottom up approach is our succussion. Where nanoparticles are physically developed, there are different ways of developing nanoparticles. There are three ways: physically developing, chemically developing, biologically developing. In physical development of nanoparticles, this is top down approach and bottom up approach. This top down approach, bottom up approach, where the nano scientists are doing now, homeopathy has done 250 years ago. That advance is our homeopathic medicines. How will you understand this? You have to know the modern. This is not modern science. Science is science. Science is same for homeopathy and allopathy. You cannot say this is their science, it is my science. Science is same. You don't know about that science because in undergraduation you are not thought about it. That's the reason you are behaving like a illiterate person. there is no still thinking about vital force. So these are all outdated concepts. These concepts are developed 250 years ago, where there is no stethoscope, there is no germ theory at that time. They have done, they try to explain it. Even I have seen homeopathy was invented in 1796, right? First, it was published. Similar principle was published in 1796. From 1796 to somewhere around 2 to 3 years, Hahnemann used only crude medicines, diluted medicines. He diluted, but he did not convert them into nanoparticles. He started converting into nanoparticles after 3 to 4 years of practice. But he proposed dynamization theory after 30 years, 29 years he proposed. This 29 years he was experimenting with nanoparticles. He doesn't know that is nanoparticle. What he says is the effect of crude drug is different from the effect of dynamized drug.
Medicines. Yes.
What exactly he mean by dynamized drug? He especially mentioned in some of his writings unknown powers. What that unknown power is?
This
Conversion of nanoparticles.
Yes.
At that time we did not have this electron microscope, TEM, SCM electron microscope. We are not able to see those nanoparticles at that point in time. But he is able to identify the medicine which is in crude form works differently when the medicine is converted into nanoparticles. Converting into nanoparticles he doesn't know, but something is happening with trituration and succussion. The crude medicine is behaving differently. That he called dynamization. But he at that time he don't know it is due to nanoparticles. To explain this different effect, he has named it as dynamization, but he clearly mentioned unknown. He used the word, I don't know what is happening. But when you dynamize it, dynamize means converting into nanoparticles, the effect is different. Now it is our duty to know pharmacokinetics and pharmacokinetic dynamics of the nanoparticles. You should not say that Hahnemann told that it is important to treat the patient, not important to know how the medicine works. It is not our system of medicine. This is all garbage. This is all wrong. This should not be done. We have science is same for everyone. Medicine is observed, distributed, metabolized, eliminated. It will have both pharmacokinetic and pharmacodynamic effects which we have to elicit now.